Today we are talking about the bone sarcoma. Bone sarcoma is a type of cancer which occur in a bone. It is a very rare type of cancer. Its incidence is usually 1% of the total cancer in the world. Actually, bone cancer could be a primary or secondary. The primary one is that when the cancer arises directly from the bone, and the secondary cancer is that when some other carcinoma metastasize to the bone. The most common type of bone cancer are the secondary cancer, but primary bone cancer are the cancer which arises from the bone from a pre-existing lesion in the bone, which are the osteosarcoma, Ewing sarcoma, chondrosarcoma, and some other type of sarcoma like fibrosarcoma. Risk factor for the bone sarcoma are usually most of the patient don't have any other risk factor, and other risk factor are genetic like neurofibromatosis, Olier's disease, hereditary multiple exostosis, Maffucci syndrome. Age. The most of the patient of bone sarcoma usually in the young age, and the secondary type of bone sarcoma occur in older age. Symptoms of the bone sarcoma usually precedes 2-3 months before the patient reaches to the clinician, like swelling, pain in the bone, pathological fracture like fracture after without trauma, unintended weight loss, and low-grade fever. Bone sarcoma can spread to the other bone or the lung and may spread to other organ, but usually incidence is very low. Correct diagnosis is the most important part of the management of bone sarcoma. Input from the sarcoma surgeon, radiologist, and pathologist is very important to make a correct diagnosis. For treatment options in bone sarcoma, surgery is the most important part, and chemotherapy is the second most important part in the bone sarcoma. And radiation we use usually in the Ewing sarcoma, but with caution. And the outcome of bone sarcoma in initial stages is very good, like we can achieve a 70 to 75% of 5-year survival in stage 2 and stage 1. But when it metastasizes to the other organ, then the 5-year survival remains up to 60% only.